Assalamualaikum and a very good day. My name is Nurul Radatunasin binti Khalid, and today, together with my partner, we will be presenting on the role of leadership in preventing burnout during change initiative. This topic is very important, especially in the healthcare industry after COVID-19. Burnout is more than normal tiredness. It is a stress condition that happens when someone goes through a long period of pressure without enough support. Burnout usually shows from three signs: emotional exhaustion, feeling negative or disconnected from work, and lower performance. In Malaysia, burnout is also a serious issue. Former Health Director General Tan Sri Dr. Nur Hisham shared that 39.1% of healthcare workers experience work-related burnout, especially among environmental health officers and lab staff. Next, change initiatives are planned changes made by an organization to improve or adapt. This includes introducing new systems, restructuring teams, or changing work process. Even though change is important, it can also make employees feel stressed or unsure. Without strong support, these changes can increase the risk of burnout. After COVID-19, burnout in the healthcare sector increased a lot. This happened because of staff shortages, heavy workloads, constant changes in rules, emotional pressure, and limited support from leadership. Many healthcare workers felt overwhelmed during this time, and this affected both their well-being and the quality of care given to patients. So, what caused so many healthcare workers to feel exhausted and burnt out during the pandemic? Let's find out. First, increased workload and staff shortages. During COVID-19 in Malaysia, burnout became very common because many hospitals had not enough staff. HRM reported that a lot of frontliners were infected or had to quarantine. So, the number of workers dropped. At the same time, daily cases went above 2,000 a day in 2021, which made hospitals extremely full. So, nurses and doctors had to take on more work than usual, and this caused a lot of stress and tiredness. Second, long hours and irregular shifts. Frontliners also had to work very long hours, some did 12 to 18-hour shifts, especially in ICU. Hospitals such as Sungai Buloh and HKL had to change schedule many times because there were too many patients. These long and irregular hours made workers lose sleep and feel exhausted, which increased burnout. Third, emotional stress and trauma. Emotionally, the situation was very hard. Malaysia had one of the highest COVID-19 death rates in Southeast Asia during the Delta wave. Frontliners had to see many patients getting worse quickly and sometimes passing away in the same shift. Many shared that they cried after work or felt very stressed. This emotional pressure added to burnout. The last process is lack of leadership support. Another reason for burnout was the feeling of not enough support from the leadership. SOPs changed very often, instructions were sometimes unclear, and mental health support was limited. Early in the pandemic, PPE shortages were also reported in the news, making frontliners feel unsafe. Because of this, many workers felt unsupported, and this made burnout even worse.
Hi, my name is Nur Shahira, and today I will be explaining how burnout affects healthcare workers and why strong leadership is crucial in preventing it. Burnout has become one of the most serious issues in the healthcare industry, especially after COVID-19. When burnout happens, the first impact we see is a decline in patient care quality. Workers become mentally drained, easily distracted, and more prone to errors. A study in the World Journal of Advanced Research and Review found that burnout is strongly associated with reduced patient care quality and higher clinical error rates. The second impact is high turnover, where exhausted staff start planning to resign because they can no longer cope emotionally. BMC Public Health report that burnout significantly predicts turnover intentions among healthcare workers. The third major impact is mental health decline, especially emotional exhaustion, anxiety, and depression. A Malaysian study during COVID-19 revealed that 40.6% of healthcare workers suffered high burnout linked to physiological distress. And finally, burnout also causes low morale and weak teamwork. When many staff feel emotionally drained, cooperation drops and the working environment becomes tense. A local +1 study on 1,620 Malaysian healthcare staff confirmed that burnout results in lower motivation. All these impacts show how burnout is not just an individual problem, it affects the entire healthcare system. Because these impacts are so serious, leadership plays a key role in preventing burnout. Strong leaders provide emotional and physiological support, helping staff feel valued and less overwhelmed. Proven by research showing that empathic leadership reduces emotional exhaustion. Leaders also manage workload and staffing, because nearly 50% of burnout cases come from work overload. The third role is clear communication. When leaders communicate openly, staff feel safe and confident. In fact, poor communication can directly increase burnout risks. Leaders must also practice recognition and appreciation, because Malaysian studies show that recognition significantly reduces burnout among nurses. And finally, leaders need to build a supportive work culture. According to the WFSA report, leadership shapes the organizational climate that can either protect staff from burnout or make it worse. So, overall, while the impact of burnout are very serious, strong and supportive leadership can reduce these risks and create a healthier, more sustainable healthcare environment.
Last but not least, to conclude this issue, burnout in the healthcare industry is a serious issue that becomes much worse after COVID-19. Staff shortages, heavy workload, emotional trauma, and lack of leadership support all contributed to the crisis. However, strong and supportive leadership can make a huge difference. By managing workload, communicating clearly, giving recognition, and supporting staff emotionally, leaders can prevent burnout and strengthen the entire healthcare system. That's all from us. Thank you.